Great. Welcome back, everyone, to the House Healthcare Committee. It is 1 o'clock, and we're switching gears again to the Vermont Department of Health. So welcome, Kelly.
Thank you. It's great to be here.
Thank you. What I would like to do is introductions of the committee. But first, we actually have some guests with us today from Middlebury. So if you all will take a moment and tell us your name, where you're from, what you're studying, so we just kind of know what's going on. So you want to start?
I'll start. My name is Dave. I'm very glad to be here. I'm from Orlando, Florida. It's very different from Vermont. I am a sophomore double majoring in neuroscience and
Wow. And do you like snow?
I'm getting used to it.
Okay.
I'm looking forward to learning how to ski soon.
Great. Good. Well, after tonight, you might have a lot of snow for it.
Hi, I'm Wyatt. I'm from Connecticut, so not too far away. And yeah, it's been cool to be here today and see all of this. And yeah, I'm a sophomore as well, and I'm an econ major.
An economics major?
Yeah.
Great. Welcome.
Hi, I'm Thomas. I'm from Montreal, Canada. I'm a freshman and I'm an economics major.
Wonderful. And you're used to
You a
snow.
hockey player?
Hockey coach over here, so maybe he knows what to talk about.
Did a good job this weekend.
These guys too, also hockey players.
Oh, you all are. Good.
I'm Jin. Nice to meet you guys. Thanks for having us here. I'm from Stamford, Connecticut. I'm a sophomore as well, studying econ.
Great. I can understand why you're in the classes that you're in and why you're here. So
I would love to interject.
yes.
It's great to hear from these Middlebury students because my son was just admitted to Middlebury as a Feb starting in February of 2024. So
That's exciting. Congratulations.
thank you.
Yes, that's fine. So, and we have one other person in the committee room. I don't want to leave anyone out. Would you like to introduce yourself?
My name is Dylan Burns. I'm the Health Services Director of Vermont Care Partners. I'll be presenting with you next week, and I'm also a hockey player.
Oh, yeah, I love it.
I thought these guys were from UVM. I didn't get the Middlebury part.
And I apologize because I knew who you were and I just didn't make the connection. So I apologize for that. Okay, so let's go around the room as well. Let's start with Joe.
Hi, I'm Joe Andriano. I live in Orwell. I also represent Shoreham, Whiting, Sudbury, and Hubbardton.
Alan DeMar, and I represent Enosburg and Montgomery.
Oh, I'm sorry, Alyssa Black. I represent Essex.
Roy Houghton, City of Essex Junction.
Chopping McFong. I live in Barrytown, represent Barrytown, and a piece of Williamstown.
Laurie Cordes, representing Lincoln, Bristol, Moncton, and Starsboro.
Leslie Goldman, I represent Wyndham 3, which is Rockingham, Westminster, and Brookline, which includes Fells Falls.
I'm Art Peterson. I represent Clarendon, Wallingford, West Rutland, or a piece of Rutland Town.
Great. And we do apologize. We have a couple committee members out today. And I don't know, Kelly, I just want to start with, we're working really closely this session with House Human Services. Mm-hmm. And so I know normally Vermont Department of Health has spent most of their time in human services, but we won't ask you to duplicate efforts, but we are really interested in everything that you offer and specifically focusing on the suicide prevention work you're doing and then the healthcare workforce initiatives that were put in place last year that we want to hear more how the money's getting out the door, but also an overview. So I'm going to, with that, turn it over to you.
Great. I'm going to go ahead and share my screen.
Thank you.
Can you all see that?
Yes.
Great. So I want to just start by giving an overview of recognizing that there are probably, I know that there are some new committee members.
Yes.
Giving an overview of not just the health department, but public health in general and sort of what that means in a very brief presentation here.
Great.
So for the record, I'm Kelly Doherty. I am one of 2 deputy commissioners here at the health department. And you can see here on our screen the vision and mission of the health department. I won't read this to you, but really our work is about protecting and promoting the best health for all Vermonters. We do that through this presentation. And I don't know if Claire saw, I did send an updated presentation shortly before the meeting. So the slides might be slightly out of order if you didn't get that updated presentation.
I think we're good, right?
Okay.
We're good.
All right, great. So what is public health? Oftentimes people conflate public health and healthcare, but public health is really about populations. So protecting and improving the health of entire populations versus healthcare, medical care, which is really about addressing the individual. So, you know, whether it's communities, businesses, organizations, and we do through education, promotion of healthy lifestyles, activities to prevent disease and injury, preventing environmental hazards from affecting people's health, and detecting, preventing, and responding to infectious diseases, which has, as you know, been a large focus of our work over the last few years. So some examples of things that public health does, you know, we promote and administer vaccines. We protect people from disasters and disease outbreaks. We screen newborns, cancer screening. We do a lot of work in tobacco reduction, substance use reduction, STDs and HIV. We promote access to healthcare in rural areas and promote healthy lifestyles and workplace wellness, among other things. And the goal of public health is, you know, I often say it's sort of the best kept secret, at least before COVID, because when public health is doing its job, people aren't really aware that we're doing it. You know, we're protecting people through various means that often just goes unnoticed. So thinking about how we do this, we really try to focus on things that will give the biggest impact on the larger population. So we like to think of interventions sort of at multiple levels. So we may, you know, one thing we do in our chronic disease division is we offer self-management classes for people with diabetes or pre-diabetes. That's a very individualized intervention. But then zooming out, we do things like work on policy initiatives that will help sort of make the healthy choice the easy choice. Some examples are, you know, in the tobacco world, working on tobacco-free workplaces and environments. You know, if you make it more difficult for people to engage in unhealthy behaviors, you can help stem those behaviors. Or increasing the tobacco tax really had a big impact on rates of smoking. So really trying to get that full range from individual, you know, community, all the way up to the policy level. So thinking about the Vermont Department of Health, this is how we are organized. And this is actually a fairly new graphic that we developed. So the blue part of the org structure is our sort of programmatic divisions. So they're the parts of the department that have a specific programmatic focus and sort of deliver services or programs to the community. The green boxes at the bottom are sort of our foundational sort of cross-department units or offices that support the work of those programmatic divisions. So, you know, obviously, like most state government, we have a business office, we have a communications office. We have a fairly new Office of Health Equity Integration. So we received a CDC grant, a health disparities grant, and it allowed us to really create a huge focus on health equity. And the vision there is that that health equity office really works across the department. We have our legal and policy unit, an operations unit, and our planning unit, which does a lot of our strategic planning. And I'll talk about some of their work later in the presentation. But I'm going to walk through these programmatic divisions quickly. So our Division of Environmental Health does a lot of work around preventing illness or disease that's caused by environmental factors. So, that could be natural things, like radon that, things, and reduce harmful exposures. So some examples of that are lead, cyanobacteria or blue-green algae blooms that we've unfortunately been seeing with increasing frequency in our lakes and ponds. Food and water safety. We have inspectors that go out and inspect restaurants and lodging facilities and other things to make sure that they're operating in a safe manner. And we also have a small group of folks who are looking at the effects of climate change on health. So those are just some examples of our environmental health work. Our Division of Maternal Child Health has programming across the lifespan before, during, and after pregnancy, throughout infancy, early childhood, and the school years. So we do a lot of work around breastfeeding advocacy, and breastfeeding support. We run our WIC program through our local offices of health, and that's the federal program that provides supplemental nutrition services to low-income families. We do a lot of work with schools around Vermont on their health policies and help support the school nurses. And we do a lot of work around adolescent health as well. Our Division of Laboratory Sciences and Infectious Disease is really the division that works to track, prevent, control the spread of infectious disease. So whether that's COVID, flu, HIV, other sexually transmitted infections, hepatitis C, that is the division that does that work. They also look at foodborne illness. So if there's an outbreak of salmonella or something, we have epidemiologists who will investigate those outbreaks to identify the source so that it can be mitigated. It houses our immunization program, which provides vaccine to providers across the state, and obviously did a ton of work during the COVID pandemic in pushing our vaccines out across the state. And then the picture that you see there is our public health laboratory. So we have a pretty impressive laboratory facility that's located in Colchester, which is where we do a lot of the testing for, those waterborne illnesses or foodborne illnesses, rabies, other, all different kinds of laboratory testing that happens there. Our Division of Substance Use Programs, which was formerly known as ADAP, it changed its name last year to the Division of Substance Use Programs. So this division oversees a large network of prevention, intervention, treatment, and recovery services for substance use, including our opioid treatment hubs. And basically, its mission is to reduce and eliminate the health impacts of alcohol and other drug use. We fund through this division community prevention coalitions across the state. We try to ensure that every Vermonter who needs access to services, substance use services, has access to them. We do a lot of work around raising awareness around the dangers of prescription opioids, and also trying to work to end addiction stigma, which is actually one reason why we changed the name of the division. So ADAP stood for the Division of Alcohol and Drug Abuse Programs. And the word abuse is really falling out of favor in the substance use world because it implies that the person has a choice. And so that's why we changed the name. We do a lot of community awareness campaigns around substance use, and you may have seen some of them in the news. And the Division of Substance Use Programs also, I mentioned treatment, but it oversees a network of treatment providers across the state. So there are certain standards that they have to meet in order to be one of what we call our preferred providers. Our Division of Local Health is the division that oversees our 12 district offices across the state. So these district offices are providing direct services to Vermonters, such as, WIC clinics, vaccination clinics, but also outside of the direct service world, they're also sort of mobilizing their communities around health efforts. So they'll be taking maybe some of our chronic disease prevention work out down to the community level. We also have substance use prevention consultants in all of these offices that work in their communities with those coalitions to do substance use prevention work in their communities. So this is kind of where the rubber meets the road of a lot of our programs in the health department. The Division of Health Promotion and Disease Prevention is our chronic disease focused division. So they do a lot of work around promoting healthy lifestyles to prevent chronic disease and also to support the management of chronic diseases like those living well workshops I mentioned earlier. This is where our tobacco control work sits. We have an office of oral health, the diabetes self-management, and healthy aging. All of that work happens in this division. Emergency preparedness and injury prevention, or what we like to call DEPRIP, is our division that is there to prepare for and respond to emergencies that threaten the health and safety of Vermonters. And they also do work to prevent injuries. And this is actually where our suicide prevention work sits that I'll be talking about in a moment. The state EMS office is run out of the emergency preparedness division and pandemic and disaster response. So although virtually the entire health department worked on the COVID response, it really was kind of led out of this division. And our health statistics and informatics division tracks health data and trends to assess the health of Vermonters. So we collect a lot of data. This is where our vital records office sits. So all birth certificates, death certificates, and other vital records are held here at the health department, and from which we can glean a lot of data. We do a lot of population health surveys, such as the Youth Risk Behavior Survey that's done every other year in Vermont high schools and middle schools, where we collect data on sort of youth behavior. We do the Behavioral Risk Factor Surveillance System survey, which is a survey of adults to get a sense of sort of what their health behaviors are so that we can help we can use those data to drive our programming. And then we have several registries in the Health Statistics and Informatics division, including the immunization registry. So whenever you get a vaccine in Vermont, that information goes into our immunization registry. That's how we were able to report on the percentage of people who got COVID vaccines. And we have a cancer registry, and then we also have the Vermont Prescription Monitoring System registry. So those all sit in this division.
Kelly, do you mind if we interrupt for questions, or do you want to wait till the end?
Not at all. I'm happy to take questions as they come up.
Okay, so we have Art.
Yes, thank you.
Yeah, but that's eventually.
Go ahead, Art.
I assume that the surveys and everything are voluntary?
Yes.
Okay, thank you.
All right.
I have a question about the emergency medical services.
Mm-hmm.
Is MSAC, the Emergency Medical Advisory Services Advisory Committee, still active? And is there still an active EMS fund for training?
I believe the answer to both of those questions is yes, but I'm going to confirm that and get back to you.
Thank you. And if there is the last report I'm aware of, and I have not looked recently, is from 2020. So if you could also include a link to any recent report from MSAC, that would be appreciated.
Okay.
Leslie? Hi. It's a pleasure to meet you. I was thinking about the cigarette and smoking, really impressive work that was done in terms of behavior change and reducing deaths from cigarette smoking, which is the goal. And I'm wondering if we know that I think the highest number of deaths in Vermont come from heart disease, probably likely related to poor diet, diabetes, et cetera. And I'm just wondering if the health department is looking at, I don't know, a public health approach to sugary drinks, those kinds of, would an excise tax be beneficial? What other levers are there available to us to help people change behavior to be healthier?
Yeah, I know that issue or that proposal has come up in prior years. I think that we like to say, like I said earlier, to, have the healthy choice be the easy choice. So certainly, those types of interventions can certainly be effective. And I think that they've been effective in other places. I'm thinking about Philadelphia had a tax on sugar sweetened beverages. But certainly we also do a lot of work around kind of like the built environment and helping towns sort of make it so that being active is easier. So that's another way that we've done that work, but certainly that's the types of interventions that we like to look at.
So if I may, are you at the health part thinking about that kind of lever or not really this year and doing other stuff?
We haven't discussed it recently, so I can't say.
Yeah, I mean, I only think about it because like you say, there's just so many different opportunities. So one's built environment, one's excise tax. So it might be interesting to look at it as a whole. And I'm just wondering about that.
Mm-hmm.
Brian?
Hi, this is Brian Chena from Burlington. You were mentioning helping towns when they're creating infrastructure to promote health, and I'm wondering if you're connected at all with. There was a pilot project embedded in a housing bill S226 last year that talked about bringing together all these different apparatuses, whatever. Of government to plan a neighborhood of the future. And if you want, I can email you that bill or the language that I'm talking about. But I don't think anyone thought to include the Department of Health in that work group. And I just wonder if you've been invited to be part of that, because we talked about the idea of designing a neighborhood that would promote equity and many other things. But I don't think anyone thought about public health like the way we're looking at it here. So, I mean, has anyone reached out to you? And if not, do you think if I send you the info, do you think that's something that the Department of Health would look into?
Yeah, I'm not aware that we are. I can certainly check. That work comes out of our Health Promotion and Disease Prevention Division. So I could check with them. I haven't heard that we are involved. So I can certainly look up the bill and ask around here to see if anybody has been working on that. And I think that it would be something that we'd be interested in.
Would you mind if I sent you an email with the exact language just to send to you?
No, I would love that. Thank you.
I'll do that.
Thanks, Brian.
Thank you.
All right, Kelly, I think we're good to continue.
Okay, great. So like I said before, we are very focused here at the Health Department on health equity. So making sure that every Vermonter has the same opportunities to be healthy. This is something that was a priority for us before COVID, but just like across the country, COVID really just shined a bright spotlight on health inequities in Vermont, particularly among people of color and our Indigenous populations, and just underserved communities. So, and the CDC recognized that, which is why we got the Health Disparities Grant that allowed us to staff this Office of Health Equity. So they are doing a lot of work with community partners and populations in Vermont that have disparate health outcomes to try to sort of bend that curve. So just wanted to highlight that. So this is our state health improvement plan sort of summary. So every 5 years, the health department engages in a very large state health assessment, and we're actually going to be embarking on that this year. We're a little overdue because we were a little distracted over the last few years. So we do this big state health assessment that not only looks at data, but it also has a large community engagement component. And based on the outcome of that state health assessment, we develop a state health improvement plan. And it's really important to recognize that this is not the department's plan, it is the state's plan for improving the health of Vermonters. And so our latest state health improvement plan was for the period of 2019 to 2023. So obviously in need of updating. But these were the health outcomes that we were looking for, that children achieve their optimal development, that communities support healthy living and aging, lifelong opportunities for oral health, resilience and mental wellness, and social conditions that promote health. And then, you know, we develop these strategies to address that. I can put a link to the current plan, send a link to the current plan if you want to dig into it in more detail. But
that would be helpful, Kelly.
Okay. And but really comprehensive and really, like I said, using the data and the community input to develop sort of our plan for how to address the health of Vermonters.
Great. We do have a question. Go ahead, Jeff.
Yep.
Yeah, my question is, you said that it is the state's plan, not the department's plan. So I'm wondering what other stakeholders were involved in actually writing the plan, or were they just giving input as to data and then the department, you know, was the one that wrote the plan?
Yeah, so when I share the link, if you look on the back of the, well, I guess it's going to be electronic, but on the final page of the plan is a list of many stakeholders that were involved in creating the plan. So not only did they provide input, but they were active participants in developing the plan.
Thank you.
Leslie?
This is very quick. I missed, I'm sorry. Did you say there's a plan to go through to the next iteration of this, or?
Yes.
Yeah. So
yes.
Can you talk about that for a minute?
Yeah, so we are going to be embarking on our state health assessment this spring. And that will take until probably the beginning of 2024. And then in 2024, we will develop the next iteration of the state health improvement plan.
Thank you.
Okay, I think we're ready to continue.
Okay. This is just an example of our measuring outcomes. So we have on our website sort of this dashboard of different goals that we have by division in the health department. And so we track sort of how we're doing. And so if you went on our website and, you know, I can also send a link to that, you can see some of the things that we had been tracking. We're actually kind of going to be doing an overhaul of this to first, because the healthy people, which is a thing that is a national initiative, every 10 years, they update sort of what the healthy people goals are. And then we take that and we Vermontize it. So we're doing our Healthy Vermonters 2030, which is the, you know, setting targets for where we want to be by 2030. So we're going to be updating this, but this is just an example of how we monitor sort of how we're doing. And then finally, just to emphasize, the role of public health. So healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. And that was C. Everett Koop, the former Surgeon General. And you probably know David Englander, who's our senior policy and legal advisor, who is a primary point of contact for the committee.
Great.
I will stop sharing my screen.
Thank you. That was a great overview.
Good. Any other questions about the department in general?
Art?
How many total employees do you have?
We have just over 600 employees. And that is, in multiple locations. So we have our building here in Burlington, which is our central office. We have our laboratory, and then we have our 12 district offices across the state, as well as the office of the chief medical examiner, which is based up at the medical center.
Thank you.
Right.
I know you mentioned the future Office of Health Equity. And I'm just curious if you had any more info about the work of the Health Equity Advisory Commission you could share right now. I know it's not in your division, in your
right.
Jurisdiction yet. But
yeah, it's not in our that's run out of Susanna Davis's shop, but we do have representatives from the health equity team here at the health department that sits on that committee. So I don't know when they last met, but I could certainly get an update for you.
Yeah, I think maybe we could just hear from them
Okay,
when the time is right. Yeah,
We'll
I did just send you that email, so I wouldn't forget. So.
Great, thank you.
Yeah, thanks.
Leslie?
So I'm just wondering how we, from a policy perspective, can support your work. What would you need that could advance you?
Oh, that's a great question. So I think that as legislation or bills are introduced, that may have an impact on Vermonters' health or on the department itself, that you invite us in for input. I think that's, incredibly important to include us early and often, just so that we can be sure that you have the information that you need to sort of put the best legislation forward.
We will definitely do that. Thank you, Kelly. All right, I want to make sure we have time for your suicide prevention work and then an update on the workforce.
So I'll start with the suicide work. So we have a couple of different grants that are active right now, suicide prevention grants. So we have a grant from the Centers for Disease Control and Prevention that is a 5-year grant. We're currently in our 3rd year of that grant. It ends in August 31st of 2025. So the work that's been happening on that grant is we launched a statewide prevention initiative called Facing Suicide Vermont, or Facing Suicide VT, in collaboration with the Department of Mental Health, that provides information and resources about how to get help or give help for people who are struggling or are in crisis. So the campaign features Vermonters with lived experience and highlights resources such as the National 988 Suicide Helpline, and also population-specific resources. So we're going to be expanding this Facing Suicide VT to include youth resources and family-specific resources. So we're also working on a suicide data linkage project that's similar to, if you're familiar with our social autopsy report. The social autopsy report looks at Vermonters who died of an overdose and looks at what systems they interacted with in the time leading up to their overdose, and in an effort to sort of intervene early. So we're doing something similar with suicide, So trying to identify people who die by suicide, what state systems they've interacted with to try to, intervene and prevent suicide. We have also worked to engage with getting information from community partners and people with lived experience of suicide. Maybe they had a family member who died by suicide, to develop a report and a strategic plan for improving prevention resources. And we're also working with Dale and EAP on several projects.
I'm sorry, can you say what EAP is?
I'm sorry, Employee Assistance Program.
Okay, thanks.
Sure. To develop a new peer support program for Vermont first responders. And it's also collaborating with our Division of Substance Use program on a pilot to work with construction companies around suicide prevention and substance use, because we know from the data that construction workers die at higher rates from suicide and from opioid overdoses. So, so that's some of the work that we're doing with that grant. We also are partnering with the Vermont Program for Quality in Healthcare, who I think you may have heard from just.
Yes, we did recently. Yep.
Yeah, so we're working on them with on a quality improvement program to provide resources to Vermont hospitals to support tailored initiatives on improving quality of care for suicidal patients presenting at the emergency departments. So, and it's based on, evidence-based suicide prevention strategies like screening and assessment, brief intervention, and safety planning. All of Vermont's 14 hospitals participated in the project. So that was really exciting. All the hospitals have completed the Zero Suicide, which is a evidence-based program, organizational assessment. And over 180 hospital staff have completed training. So that's really exciting. We have one other suicide grant that is also a 5-year grant, and we're in the first year of it now. This is from the Federal Substance Abuse and Mental Health Services Administration, or SAMHSA, and it's a youth-focused grant. And so right now, because we're just in the first year of it, we're recruiting to fill the program manager position and are setting up agreements with community partners. So that work is kind of just starting, but the goal of it is that it will serve youth at risk of suicide by, again, developing prevention, screening, and treatment infrastructure in youth and family organizations. So that, is a great development. And we're going to focus on implementing in Vermont's regions with the highest suicide risk burden, youth suicide risk burden. So that will be Chittenden, Rutland, Bennington, and Windham counties, and then some particular populations of focus such as LGBTQ plus youth. So a lot of work happening in that arena.
So Kelly, can I just interrupt real quick? I just recently saw a posting for a youth suicide prevention coordinator. So is that part of this grant that you just discussed?
Was it at the health department?
I think it was, yes.
Yeah.
Okay.
Yeah, that's the program coordinator position that we're recruiting for.
Great.
Yeah. And, we continue to work with DMH closely in this work. And then we're also making sure that we are putting data out on suicide, because that also, sort of raises awareness. And during calendar year 22, we published 14 suicide related data products to our website. So really trying to make that information prominent, just to raise awareness.
That's great. I have a question, Kelly. So we've had obviously UN, VPQHC, Department of Mental Health. We've had all sorts of organizations in to educate us on the healthcare system. And in most of them, suicide has at least been mentioned, if not further discussion. And it makes me think, and I'm not sure if this is correct, that we're doing prevention work in a lot of different places, but is there coordination of all of that work in one place?
That's a great question. And I think that, I think it's a positive that the work is happening in so many different places because we all sort of, there's a lot of overlap in the populations that we touch, but we also have our unique sort of opportunities to reach certain populations. So I would say that it's, it doesn't really live in one place, but we are holding these grants. So by virtue of that, you know, we're holding a lot of the work, but we are certainly working very closely with our DMH partners. And then we work with VPQHC very closely on a number of different projects. So, you know, I think that it's being well coordinated, even if it doesn't necessarily live in one place.
Great. Alyssa?
I'm wondering, you know, I mean, going with the philosophy, and you talked about this with substance use disorder, that if we're going to target prevention anywhere, particularly around public health issues, as much data as possible. And when it comes to suicide, do you feel like there are any gaps in data that's being collected? Are we targeting, are we able to target the right things to the right places, to the right people? Are we getting enough information in order to do that? Statistics.
I think for the most part we are. I think that this data linkage project is going to help expand that, because we will be able to get more information about those people who die by suicide and sort of some of their characteristics, and also sort of, again, those systems that they interacted with. But we do already know a lot. You know, we have information from our youth risk behavior survey, for example, does ask about suicidal ideation, and it slices and dices that data to, you know, to show us how youth who are LGBTQ plus are much more likely to think about suicide, make a suicide plan. We know, you know, so there are areas like that where we can really identify sort of those populations that are more at risk. But certainly this new data linkage project is going to provide a lot more of that information.
Okay, thank you.
Any other questions on this topic before we move to workforce? Mari?
I'm actually a proxy for another healthcare member who's not healthy right now. Wondering about the Vermont Suicide Prevention Center. Are they still holding a big piece of work the state contracted them to do previously through Center for Health and Learning?
I believe so. We worked very closely with Center for Health and Learning, but I'll double check on the status of that contract.
Thank you.
Thank you. All right, so if we can move to the workforce, Act 183, I think there's two areas that VDH touches on.
Yes. So there were a few areas in Act 183 that the health department was tasked with. And I am happy to say that the loan repayment portion, the nurse faculty forgivable loan program, the nurse faculty loan repayment and the mental health professional forgivable loan program. Those are all moving. We have grants with either AHEC, the Area Health Education Center, or VSAC, the Vermont Student Assistance Corporation, to implement those programs. So those grants are moving through the system, and that money will be getting out. So
Can you give us a timeline on when you think that money will start?
Yep. So the grants are out and are with them for signature. So the only one that's been a little more delayed is one with VSAC, just because they were aiming for a May launch date because the funding wasn't cleared in time to make it for the spring semester. So it will be, that money will start flowing out late in the spring for the fall. So, but the other ones are moving. As soon as we get the signed the signed agreements back, that money will start flowing. The place where we've really been challenged is the grants to nursing schools for compensation of faculty and staff. So that has not moved, and despite our best efforts. So back in the early fall, once we got a clear understanding of the guidance, because this is the emergency funding,
right.
We reached out to all of the nursing schools in Vermont and provided them information on the program and what the requirements were. So, and just so that you know sort of what the lay of the land is in terms of what this funding is for, it's to increase the compensation of nursing faculty and staff, because in order to improve the pipeline for education of nurses, because we know that there aren't enough faculty to teach, the number of nurses that we need. So, so the funds would be distributed to nursing schools so that they could enhance their salaries. So, there are a number of requirements that need to be met in order for schools to be eligible to use this funding. Some of it is the nursing faculty need to be doing work that is deemed essential during the COVID-19 emergency. So that means, the way that's defined by the Treasury Department, the US Treasury Department, that they're doing work that requires regular in-person interaction with patients, the public, or coworkers, and is not performed by telework, or requires the regular physical handling of items that were handled by or are to be handled by patients, the public, or coworkers. They either need to not be exempt from the Fair Labor Standards Act for overtime, or their wages are not, this is where it gets really complicated, their wages are not increased by the premium pay to 150% or above of the average state or county annual pay for all workers, or whichever is higher. So, the nursing schools were provided with all of the requirements.
And the requirements, I want to be clear, are from the federal government.
From the federal government, yeah. So we had a number of outreaches to the schools, and up until they went on winter break, and then even in January. And the conclusion has been that most don't think that they are eligible because of the requirements that are in place. Although the last communication we had with Vermont State Colleges was that they thought that they could meet the eligibility criteria. So we let them know that in order to move forward, they needed to provide information on exactly how they meet the eligibility criteria. And despite multiple follow-ups, we haven't heard back from them. UVM, because of the 150% of the average salary cap, didn't think that most of their faculty would be able to meet that criteria. And even if some of them did, it would be an administrative nightmare to try to, and an HR probably nightmare to try to provide it to some people and not to others.
Right.
And Norwich University said that they didn't think that they could meet the criteria. So we're still trying to follow up with them, but it's really been complex. And
Yeah, appreciate that.
Yeah, so it's and I do believe that I think it was UVM was going to be reaching out to see if an alternate source of funds could be used to fund this because of the requirements that are, on this funding from the federal government.
So we have a couple questions, but I want to stick to this real quick, just so everyone understands what we're talking about. This was on the chart that Ina Backus presented to us, and it was the very first one. So it's section 20 for $2 million. So Kelly, do you know, we're, looking at repurposing the money. Do you know the guidelines of when the money has to be spent?
Yes, it has to be spent by December. I think it's December of 2026.
Okay.
But it's also contingent upon the continuation of the federal public health emergency.
Ah.
So if the federal public health emergency ends, then we can't spend any more money on this, after that.
Jump on it.
All right, Art, and then Joe.
Yeah, I think you kind of answered it, Lori. It's kind of as much for you. Ina talked about the preceptors having a similar problem, I believe.
Yes.
I don't know if that problem is the same though as this problem.
No, I think it's a slightly different problem.
Okay,
and they are still working through that.
Okay, all right, that was my question.
And we'll have to follow up with them. In the testimony from Ina, that one didn't seem like it couldn't happen. It was been working through.
She's not dealing with employees of a college, so to speak, right? I mean, in the preceptor thing.
Right, so these are, right, exactly, right. And so, Kelly, I want to be clear. At what point or when do you think you would say to us, this just is not happening? Are we at that point?
I don't think we're quite at that point. I would like to be able to follow up with them one more time and get a final answer, because we reached out to them the week before last and haven't gotten a response on sort of whether they're going to still try to move forward or not. So I would like to get a definitive response from the schools before that. So, but I think that we can do that in fairly short order and sort of know what direction we're headed.
Okay. And I know in regards to the federal emergency, I know in terms of Medicaid redeterminations, that is now ending, but there is no date yet for the end of the federal emergency, correct?
Yes.
Great, thank you. Joe?
Do you have a citation to the Code of Federal Regulations on those particular requirements? Because I'd like to take a look at them.
I can send that to you.
Thanks.
Any other questions? Not to end on a depressing note, but we know you've all worked hard to try and get this out. And I appreciate you trying one more time to see if we can make it work, but then we'll have to decide what to do going forward. There was one other one. So I'm referencing again a document that Ina Backus had given us, and it's designated in specialized service agencies workforce development. And in her note, it says AHS has defined program parameters based on Treasury guidance and is working with VDH and DMH on program design and implementation. Do you know anything about that one? Section 29E.
Yes, I do. Bear with me 1 minute.
If not, you can get back to us.
Yes, I believe that this is one of the grants that is going to VSAC, but or AHEC, but let me double check on that.
Okay, that'd be great.
Mm-hmm.
This was extremely helpful, Kelly. Thank you very much.
Yes, absolutely.
Please let us know on the $2 million investment and when we need to start looking at repurposing it. And I'm talking to you again, I'm sure. So thank you very much.
And I made a list of my deliverables, so I'll get those out to Claire.
Okay, great. Thank you, Kelly. And we
Thank
are
you.
a 10-minute